Thank you for staying with us on Channels Television. A warm welcome to Health Matters. I'm Yomi Otaigbe. We are in the rainy season in Nigeria, and today on the show we'll be looking into how to manage and prevent asthma attacks. Asthma is one of those health conditions that the symptoms can get worse during this season. According to the World Health Organization, asthma affected an estimated 262 million people in 2019 and caused 455,000 deaths worldwide. It's a major non-communicable disease affecting both children and adults. And asthma is the most common chronic disease among children. To tell us more about this respiratory condition is a senior registrar in pulmonology at the Department of Medicine, Lagos State University Teaching Hospital, Dr. Temetokwe Fakbonda, who joins us via Zoom from Surulere, Lagos. Thank you so much, Doctor, for joining us.
You're welcome. Good afternoon, everyone.
Thank you. I know a lot is going on out there, but we have you now. Dr. Fakbonda is also, she is an associate member of the Pan-African Thoracic Society. Now, let me start by asking, how does asthma come about? We know it has to do with the respiratory system.
Okay,
Hello,
so
doctor.
so how does asthma come about? Okay, so first of all, just so we'll all just remind us of exactly what asthma is. So it's important for us to know that asthma is an illness that affects the airways or the air passages. So what that means is that when we breathe in air, primarily our body needs oxygen to function, to survive. So the means by which the oxygen gets to other parts of the body is through these air passages or airways. And so asthma is an illness that affects these airways in the sense that it results in some difficulties with the movement of air in and out of these air passages. And then individuals that suffer from asthma, they feel this as some difficulty with breathing. So it's a chronic illness. It occurs at all age groups. So asthma can occur in children, in teenagers, in young adults, elderly, across all age groups. Now, the cause is largely unknown. However, there are some risk factors that have been identified as a possible that could be a risk of acquiring or developing asthma. And the most important of these risk factors is what we call allergy, or atopy. So what that means is that in some individuals, their airways is a little bit hypersensitive or to some things in the environment that we call allergens. And usually this trait runs in families. So we can say that asthma can be hereditary as a result of this. Other risk factors that have been identified include things like air pollution, being exposed to air that contains pollutants has also been identified as a risk factor to developing asthma, and also some infections that affect the airways, some respiratory tract infections have also been indicated as risk factor for developing asthma. So, but because the cause of asthma is still largely unknown, apart from the major risk factor being allergy, so a lot of these other risk factors may not necessarily cause asthma, but in people that are already predisposed to having asthma, they could result in triggering the episode. So people have asthma, but it's not all the time that they have symptoms. So usually when they're exposed to a trigger, it results in what we call an exacerbation, or in a layman's language, an attack. So a lot of the things identified as risk factors majorly are actually risk factors for asthma attacks in people that already are predisposed or already have asthma. So that's what it's about. So something very important right now. Also, the weather, the season. So rainy season, then even harmattan dust. Dust it's an important pollutant of air. So it could trigger attacks in people that already have asthma.
Okay, so let's talk more about the children now. We know that it's more common in children. At what age can we begin to see the signs of asthma, or are there some kind of screening that should be done for us to know that a child is having asthma, or just some of those signs that we can look out for?
Okay, so in children, the symptoms of asthma are the same, whether it's in adults or children. And asthma usually presents with 4 cardinal symptoms, which include difficulty breathing, chest tightness, cough, and then wheeze or noisy breathing. So in children in particular, from infancy, from infants 1, 2, 3 years, children can have symptoms that look like asthma, but most times it's at that age, because their immune system is still undeveloped, they're at risk of having infections caused by viruses. So sometimes when they have these symptoms that look like asthma, it's not actually asthma. It's a viral respiratory tract infection, which would get better, and then most of these children will grow up and not have asthma. So for the pediatric age group, they actually have an age where asthma can actually be confirmed or diagnosed. Usually from ages 5 and above, because usually that is the age where they can carry out a lung function test that we can use to objectively diagnose asthma. So a lung function test is also known as spirometry. It's a breathing test, and it requires that the person follow some instructions. And also most times for children less than 5, it might be a bit difficult to actually say that the child has asthma because of challenges carrying out the test. So, but usually from the ages of 5 and above, when children keep having these symptoms, so any of those 4 cardinal symptoms, especially if they also have allergies, it makes it more easier to make that diagnosis. Also, if there's any parent or sibling that has asthma. So, like I've said, asthma is largely hereditary and largely related to allergy. So most times in children, when any of those are present, it makes it easier to make the diagnosis. But it's also important to note that in younger infants, a lot of time they have recurrent cough, they wheeze, but it's as a result of viral infection, not necessarily asthma.
So how then do we, separate asthma from any other, respiratory illness?
Okay, so asthma is not it's not infectious. I mean, it's not caused by an organism. It is actually a response of the individual. So what happens in asthma is that when people that have are predisposed to having asthma, their airways are hypersensitive. So when they're exposed to common triggers like cold air, dust, noxious fumes, or even an infection, their airway responds by closing up, so preventing them from being able to breathe in and out air effortlessly. So that's what happens in asthma. So usually if you carry out tests for infection, chest x-ray, you wouldn't really see any evidence of infection unless, of course, infection is acting as a trigger. So which is why, like I said earlier, in the younger age groups, it might be a little bit early to conclude that the child has asthma until they're able to carry out objective tests to actually diagnose asthma, which is a lung function test. So most times for the pediatric age group, so from the ages of 5, we are able to confidently make a diagnosis of asthma. Usually when they're still younger than that, it may not be, they may not be 100% sure. Or if there are other things, like for instance, if there's another sibling in the family or a parent, or if that same child has allergies, like has skin, known as atopic dermatitis, or has food allergies, then that might make it a bit easier to conclude that the child's respiratory symptoms are due to asthma. But, I'm an adult physician, so, but the pediatricians would, it's important that if we're thinking any child possibly has asthma, the child should be reviewed by a pediatrician. And definitely if they feel the child has asthma, that would be elicited in the pediatric age group. But for the adults, usually a lung function test with history is always able to make the diagnosis when it's been questioned.
More about asthma attacks. I know this season, when it's cold, it's one of the triggers. Let's look at what to avoid for people living with the condition.
Okay, so for people living with the condition, asthma, so let me still emphasize that especially in adults or from young adulthood, from teens and above, asthma is largely a chronic medical illness, so, and it's lifelong. So it means that since it's largely based on the person's genetic makeup, the person will always have risk factors for presenting with asthma symptoms, which are known as asthma attacks. So now the primary way to prevent these attacks would be to be on some form of treatment, to which we refer to as maintenance treatment, to prevent the individual from manifesting with the symptoms. So when asthma occurs in adulthood, it's not curable in the sense that it's not like the way when we have malaria that we use anti-malaria and we clear the parasites. No, it's not curable, but there are medications to prevent the individual from manifesting with the symptoms of the illness. And on the long run, preventing the illness from affecting the person's everyday life. So the number one way to prevent attacks would be for every individual with asthma to be on a maintenance therapy, which is available and easily accessible. Now, from what I said earlier, asthma is an illness that involves the airways. So the treatment for asthma is largely the backbone of treatment is the use of inhalers. Now, unfortunately, a lot of people view inhalers as things that might make the individual become addictive, or something that if the individual doesn't get access to when needed could be life-threatening. Yes, so which was why I started with talking about maintenance treatment.
Talk more about, Doctor, hold your thoughts, please. We'll talk more about that when we come back from this break, and that time will be we'll open the phone lines for our viewers to also come in, ask questions, and of course contribute towards the program. 805-42233 is the number to call. Just stay with us. Welcome back. You're watching Health Matters on Channels Television, and we're talking about managing and preventing asthma attack. It's the rainy season, so you can join us in this conversation by calling 080-805-42233. 080805-42233. Doctor, let's talk more about how to prevent these attacks from happening. You have said there should be that preventive treatment. Let's talk more about other things that can be done by parents with their children or a child who's got asthma, or for an adult who of course is living with the condition.
Okay, so from where I stopped. So the first thing, there are some other measures that can be taken to prevent attack. But these measures are really not going to be effective if the person is not on a maintenance treatment. Because what happens is that there's a continuous inflammation in the individual's airways, whether they're exposed to triggers or not, whether they're having symptoms or not. It's occurring all the time. So usually what happens is that when they're now exposed to an extra trigger, like cold weather or dust, that the inflammation increases by about 10 to 100 folds, and then the individual now has symptoms. So which means that the first step to preventing attacks is for that individual to be on some form of anti-inflammatory medication. And then in addition to now avoiding, known
Sorry,
triggers.
doctor.
So
Will
yes.
Sorry, will that not depend on the severity? Because of course there will be the mild asthma, there will be the moderately severe asthma. Then will it not depend on the severity of the condition?
So irrespective of the severity of asthma, every individual with asthma needs to be on a maintenance treatment, because that was why I was clear that it's a chronic inflammatory airway condition. There's ongoing airway inflammation whether the individual has symptoms or not. So it means that, what it just means is that in these individuals that have asthma, there's ongoing inflammation in their airways anytime they're exposed to things normally we're all exposed to in the environment. I mean, air, dust, fumes. As long as they're carrying out their normal daily activities, they're going to be exposed. And for all these exposures, there's ongoing inflammation. It's just that it's not all the time that they have symptoms. So most times, the inflammation would have accumulated over some weeks or months before they manifest with symptoms. That is in individuals that are not on any form of anti-inflammatory treatment, which is why I'm trying to emphasize that irrespective of the severity of the individual's asthma, whether it's a child or an adult, the first step to preventing
is maintenance treatment.
Is to be on a maintenance treatment.
Okay, let's have Mrs. Chijoke from Songwater. She's joining us via phone. Thank you for joining us.
Thank you very much for the information on how to manage asthma. My question now is, when a couple, one couple, the husband maybe is asthmatic, and the wife undergoes a surgery, and their blood actually matches, if he donates the blood to the wife automatically become an asthmatic patient.
Okay, so Mrs. Chijoke, you want to know if an asthmatic husband donates blood to the wife can have asthma. Is that what you're saying?
Automatically becomes asthmatic because sometimes some of these symptoms are seen.
Okay, let the doctor weigh in on this. Doctor, did you get the question?
Yes, thank you, ma'am, for the question. So the simple answer is no. So asthma, it's largely based on the individual's genetic makeup, which usually we get our genes from our parents, and then as individuals, we transmit them to our children, but we don't transmit to our spouses. So from a husband giving the wife blood, it's not going to result in him transmitting the asthma gene to the wife. So what can only happen is that the children could have asthma by reason of one of the parents having it. But the between spouses, it can't be transferred. I don't know if that answers the question.
Okay, I'm sure she's gotten that. So even if you have a blood donation or blood transfer from someone who's got asthma, the person is not going to come down with asthma because, as you said, it's genetic. Quickly, finally, we need to go now, but can a child outgrow asthma?
Yes, so it's possible for children to outgrow asthma. So there have been a lot of studies on this. So for some children, they have this hypersensitive airways when they are little, and then as their immune system further develops, as they grow into their teens, a large number outgrow the asthma symptoms and they're fine all through adulthood. However, having asthma as a child is a risk factor for developing asthma in adulthood. So it's always important that some individuals that they first start manifesting asthma symptoms as an adult, when we further make inquiries, we'll find out that they actually had asthma when they were children.
children. Okay.
But, yeah.
Thank you so much, Doctor, for your time today on the program. We really do appreciate. We really love to have you in the studio, but of course, all of the traffic and things going on out there. Thank you so much for watching Health Matters today. Do join us again next week. I've been speaking with Dr. Fakpowunda Temitokwe, who is an associate member of the Pan-African Thoracic Society and also a senior registrar in pulmonology at the Department of Medicine, Lagos State University Teaching Hospital. Bye for now.